And before, first of all, starting that, we need to first understand actually the telemedicine and healthcare delivery system. So with the telemedicine, we can have the meaning like telemedicine, like we have the all the medicated systems or all the healthcare system in through the remote actions or in the distance level. Like we have the distance education. So same as we have the telemedicine, like distance meditation. So origin of telemedicine, first of all, is in 1924, the first origin of the telemedicine. When we talk about the father of telemedicine, so father of telemedicine is Dr. J, and he's from Boston Logan Airport to MI University, and he has established the first setup of telemedicine in long back 1967. So when we want to collaborate the telemedicine with the healthcare system, so telemedicine, we know about the telemedicine, and healthcare delivery systems actually are some organizations that provide the services to medical professionals like nurses, doctors, pharmacists, etc. Their main motive or objective to provide the healthcare services at lower cost and in higher amount so that these can be made available to the large number of individuals. So when we talk about the telemedicines in healthcare delivery systems, so healthcare delivery system, we can assume that, or we can say that it is a packaged deal with having all the medical facilities with all the doctors, nurses, and whatever we can have in the medical fraternity. So this is the service provider which gives the healthcare services very easily. So according to WHO, the delivery of healthcare services is like the distance is a critical factor by all healthcare professionals which use the informations and through IT support means some communication technologies for exchange some important informations regarding the disease, informations regarding the diagnosis, information regarding the line of treatment, and information regarding to prevent those type of injuries through their research and the evaluation of that research. And for continuing education of the healthcare providers, it make able every healthcare provider to be the well-known or lit, well-literate medical professionals, all in interest of advancing the health of individuals and their communities. So WHO actually proven that WHO approved that type of healthcare services. Now, if we talk about the telemedicines in India, so in India also, in telemedicine, earlier we have seen that in 1967, Dr. J has proposed their first telemedicine setup. And in India also, in Gwalior, in 1975, at GR Medical College, the telecardiologist system has been established. So when we say the system has been established, and when we say that telemedicine is there in India or telemedicine is in the world, so that means the combination of the medical healthcare and the combinations of some IT professionals or IT setup peoples. Because without the help of these teletransmissions or the communication devices, the setup can't be possible. So with this telecardiology system also, some teletransmissions of ECG machines, because it's only related with the cardiological system earlier in 1975. So it only related with the ECG's machine, and these ECG machines has been teletransmitted in GR Medical Hospital. And later on, we have also set up India. India has also set up one Ayurvedic telemedicine system in 2017 by the Jiva Ayurveda. So this is actually is the evolution how the telemedicine comes in India, how and why and on what basis all the telemedicine systems help in India or the rural background areas. So the aim is actually that only to deliver the specialized medical care and advice within the reach of the patients at the distant places. So if we say the telemedicine, then obviously we are talking about some type of setup or some type of devices set up where actually the doctors are not there, or if the doctors are there, so not so much of qualified doctors are there, or no so much of availability of these type of doctors are there. So the telemedicine actually is the powerful tool when a reduction in patient transports in the combined with the improved care of those type of transported systems. So telemedicine also connects rural doctors with their fellow colleagues and specialists that can help to clearly diagnose or determine the treatment tactics. So if uh, already I have told you, already it has been discussed here that uh, telemedicine is the combination of not so specialized doctor with some specialized doctor or some specialized facility or the diagnosis system or the line of treatment, so that the simple doctor or the simple health workers who are in the rural area, that can be coordinate with the specialized doctor, that can be coordinate with the qualified doctor in the cities, and the line of treatment can be discussed with those type of a rural doctor can also pre-book a virtual meeting with a specialized doctor, or it can be requested to convince a virtual council of a specialized service provider. So telemedicine actually is gaining the momentum in the healthcare industry. It gives the boom to the healthcare industry. So simple, the objectives are very simple for telemedicine and to healthcare delivery systems. The objectives are, first of all, to give the specialized medical advice and to monitor the patient condition. That's what we are discussing about the line of treatment. To guide other medical staff about the treatment procedures, and also to share the patient data among the institutions for the research purpose also. Because research, always in the medical, always some new diseases are there, some new symptoms are there, some new line of treatments should be there for the patients. So everything, everywhere, we need to share with the researchers so that the another research can be done. Just we have seen in the COVID-19 research also. So healthcare services actually in general are by the government through a network of health centers from the grassroots area to the block area. So healthcare services delivery systems actually having because healthcare delivery service system, we can say the involvement of whole of the rural background, or involvement of from main government official to the rural government official. Right. So it would start from the grassroots area, like it would be the block level and in the rural area, and through hospitals, dispensaries, child cares, family welfare centers in the urban areas. So the hospital is in the subdivisional or the district level. So when we talk about the telemedicine, or when we talk about the healthcare services, so it's extremely necessary to reach the technology into the rural areas where access of those qualified healthcare is limited. Maybe the time is limited, maybe the access is limited because of the transportation, because of the busyness of those doctors. So there is something limited, whether in the terms of time, whether in the terms of transportation facilities, whether in the terms of some road facilities. So the the healthcare service providers has been provided everything for the rural area or these types of areas also. Now, how they functions? These healthcare delivery services or telemedicine services, how they functions? They functions. These can work through many types, like video conferencing between the patients and the specialized doctor directly. Sometimes the video conferencing between the different specialists and healthcare professionals, where the direct involvement of patients are not there. So if that actually saves the time for the patients and for the specialized doctors also. So if sometime the patient don't have time to meet with the doctor, the specialized the healthcare professional for that particular area can discuss their issue with the different specialists through video conferencing, or that also help to monitor the patient vitals, means all the parameters of that patient. Suppose if we are talking about the cancer, so cancer grading systems are there: grade 1, grade 2, grade 3, grade 4, and we all know the grade 4 is the highest one. So it can be observed through 1 to 4 or 4 to 1, and it can be visualized, and it can be uh, hold, or it can be preserved. The statistics can be preserved for their diagnosis or line of treatment. And obviously, the security in data connection would be there, because if the patients don't want, suppose the treatment of breast cancer of that one particular female is there, and that female don't want to disclose their disclose their data to anyone. So yes, it can also happen, and security is also there for the data connections and data availability also. So patients of data medical among the hospitals and storage of some time of information. So telemedicine programs actually have a great potential to completely change the way healthcare systems in rural areas. Some of the benefits that bring along with the quite distinct, like the patients also the disease can be diagnosed at the early stages, and disease, the severe diseases like cancer can be diagnosed at the early stages, and the line of actions or diagnosis can be start at the early stages, so that the life of the patient can be saved. Now, different type of telemedicines actually we have. uh, Types of telemedicine here, we have the interaction between between the doctors and the patients. So type of telemedicines like interactive telemedicine services. At first we have here also, we have seen the patients and the specialized doctor. So in the same basis, interactive telemedicines like the telemedicine services directly interactive with the patients and with the specialized doctor, right? Next type of telemedicine, we have the specialist and primary care consultants. So in this, no direct involvement of the patients, only the specialized doctors and primary healthcare workers can consult on any of the patient record. So next, store and forward the telemedicines. After the consultations, the diagnosis has been done, and it is stored and forward the telemedicine, remote monitoring, and imaging services. Now, imaging services like we have like suppose again we are talking about, if we are talking about the cancer process, so the cancer can be diagnosed through the imaging only, like CT scans, MRI scans, PET scan. These type of scans are only available, or only only are the parameters by which the cancer can be diagnosed through their tumor portions. Like, so imaging systems in telemedicine are also very, very important to diagnose those diseases, those cancerous diseases, those hazard diseases, so that the the diagnosis can be done in the early stages. So these type of essential equipments we have, like here, first of all, suppose this is a primary healthcare worker. So we have the desktop here. We need to have the digital cameras, then monitor, obviously, the digital microscopes. Actually, we need to have, because if the patient's having something, so the digital microscope is that if the doctor's demand, the specialized doctor demands something, so the equipment we should have, so that ECG machine also is the equipment by which we can the uh, measure the parameters of the patients. And finally, we have the scanner. Scanner is like for the imaging system. Scanner is for like the their reports. So these are the essential equipments which are useful for the telemedicines that would be provided by the healthcare provider or healthcare delivery systems. These are the necessary equipments we are talking about, like medical equipments. Obviously, when we are talking about the telemedicine, then we have the two terms. Tele means telecommunication. So we always need some IT equipments, and we have some software. So in softwares, we have different type of softwares. Mostly softwares are free of cost available for by the government, like Sanjeevani, Mercury, and Televider. So these are the very low cost and freely available software by which we can start. Initially, we can start the telemedicine, or the healthcare delivery systems can provide these type of telemedicine facilities. Now, location could be any. Can be located at non-prime location away from the patient traffic near to the communication system satellite where the connections could be good, or the no. Basically, these type of centers or these type of systems can be generated where very few possibilities of the doctors are there. If the doctors are there, then what's the need of the telemedicine, right? So if the doctors are not available there because of any reason, few doctors are available, or the limited time, for the limited time period doctors are available, like for 2 hours, 3 hours, 4 hours, and the number of patients are too many. So on that point, we can start the telemedicine services. Now, layout could be any. We can have the receptions, telemedicine conference hall where the patients or health workers can directly interact with the specialized doctor. Then telemedicine libraries, cafeterias, and rest for the rest, we can have the restrooms also. So for the healthcare delivery system, because we need to start, we can have the rural area or some these type of area where the doctor's facilities are not there. So we can have the staff, proper staff there, the head of the department, consultant, network manager, program manager, web developer, telemedicine technicians, and telephone attendant for the patient. Now, the benefit of the telemedicine. So yes, after discussing so many things, we already got to know the benefit of the telemedicines. It always gives the expertise. It always gives the specialized suggestions or specialized comments or specialized diagnosis for the person, and it very economical for the hospitals and patients also, because no transportation cost is there, and no high fees are there, doctors high fees are there, because it's a government channel. Healthcare delivery systems can provide these type of telemedicine services, so it is economical for the patient's pocket also. It reduces the stress in the patients and relatives. It saves time to specialists and the patients also, because here the patients need not to wait for in a long queue, and also the specialist, whenever the call is there, suppose a cancer patient is there, so we need to call the cancer specialist, so we can call him or her uh, just on a phone call, or just by a conferencing call. So it always saves the travel time. It always saves the time for the specialists and the patients also. Good for education and the research purpose, because we can have many records. We can have different type of activities, different type of records, different type of parameters there for the future research purpose. Okay. So patients benefit of health, we can segregate these benefit of health like in the patient wise, health professionals wise, hospital wise, and the communities wise. So obviously patients, for patients and health professionals, the main point is time saving. The whole process is time saving. It helps actually in storing the transportation limitation, which is one of the main cause for the lack of the proper healthcare in the rural areas. So it also helps in building the economic stability in the area, in immediate analysis of blood reports and imaging process or imaging data by radiologists and doctors. So it increases the chance of receiving quick medical attention, because always we have some reports. So immediate analysis, on the spot analysis, actually we have through this system, through this system. So some, if the patient have some vital parameters like their blood pressure, sugar levels, or blood oxygen levels, so it could be monitored at the regular interval from the comfort of their house, his or her house, and recorded in the patient's electronic file for quick consideration purpose. Right. So there is no need to go anywhere to check the blood pressure or for anything. So it always saves the time, and patient can sit, or patient can be in their house, or and monitor electronically all these things. So here on the screen we have phase 1, phase 2, and phase 3 telemedicine networks. So these all are from the Odisha. So Odisha Telemedicine Services in 2003, and it always explored, it extended by time. So after 2003, 2007, and 2011 data we have. Now, tele-specialization. So if we talk about the telemedicine, telepathy, or if we talk about not telepathy actually, if we talk about the telemedicine and uh, uh, if we talk about the telehealth, e-health, telehealth or telemedicines, so it can be specialized in every field. It is not necessary, or it is not like that. The telemedicine is only specialized in radiology. It's always specialized in imaging. It's specialized in this and that. No. So telemedicine or telespecialization or tele health is specialized. We can have the specialized doctor in any of the field like radiology, cardiology, pharmacy, psychiatrist, dentistry, and pathologist. So as the problem is there, we have the solution. As the problem is there, telemedicine have the solution. As the problem is there, tele health having the solution with their specialized doctor. So telehealth, now we have another term here, telehealth. So telehealth is the delivery of health care and health related education over a distance using telecommunication devices. So obviously it's a live interactive video conferencing, same, and virtual care, e-care, and healthcare. So in telehealth, we can involve the m-health also. M-health, we can have the mobile health also. Like we nowadays also we have some smart watches which can monitor our BP, which can monitor the blood sugar, which can monitor everything. At same as in the same concept, we have the M health. M health, everything means your blood pressure, your per count walks or per count step, or your oxygen level, everything can be monitored on your mobile. And virtual care can be done, e-care can be done through the mobile. So it's not specific in, and it's a huge, big actually scenario. Now, what the patient served for the telemedicine. So, more than 41,000 patients encountered in Virginia also. So, partners with teleradiology. So, we have the different of data from abroad to India. So, telemedicine everywhere. E-health, telemedicine, M-health. So when we use the term telemedicine, that means we are talking about the everything. When we are talking about everything which is related to e-health, e means electronically. So electronic health, electronic medicines. So we are talking about everything here. So this is the scenario of till now. Telemental health, okay, these are few examples we have. Like here we have telemental health, shortage of mental health providers, because mental health providers are very few and patients are so many. So the telemental health nowadays becoming a boom for these type of patients, because a shortage of mental health providers, consultants, medicines, emergency telepsychiatrists. So it can improve the access, shorter wait times, now fewer no shows, and number one request for service for these type of providers. Now, teleophthalmologists for eyes, conditions requiring screening and annual examinations for the diabetic patients, and it's the future of telemedicine department. So in telemedicine department, the government want to introduce the robotic system also, robotic surgeries also, live monitoring via their cell phones also. So live monitoring means here live monitoring uh, of the patients by the specialized doctor, because healthcare worker in the local area, the healthcare worker in the rural area always gives them always having the live monitoring, but here live monitoring through cell phone or mobile phone, meaning here is the live monitoring with the specialized doctor. Suppose we are the cancer patient, so live monitoring directly for the doctors who are dealing with the cancer. So this is the actually the future of telemedicine. Government need to introduce robotics, remote surgery, and live patient. So now, because it's the telemedicine, and in telemedicine, the healthcare service or healthcare delivery systems actually plays an important role, because access to the healthcare experts across the globe resources or globe, it has been increased now, and chances to getting a second opinion improves the severeness, improves the awareness and the patients. So once the rural population adopt the technology, it results in better patient outcome in the terms of treatment and healthcare accessibilities. So all these type of health services or telemedicine services, e-services, can be provided only by the healthcare delivery systems. So this type of healthcare systems deliver health services, they can plan how and when and why the patients can be interact with the specialized doctors. It determine the priorities, means the grading system. If we talk about the cancer patients, if we talk about the diabetic system, so it would be the grading system which need who which patient required more observations, which patient require the quick observations. So planning, determining the priorities, mobilizing, allocating the resources to the different patients, and transplanting policies into the services, evolutions, and health educations. So it the whole overall package or whole overall conclusion scenario has been decided by the healthcare system, and that has been delivered by the healthcare delivery systems. So telemedicine always uses some electronics and telecommunication technologies. These telemedicines and telecommunication, electronic and telecommunication devices has also been provided by these healthcare services to make the setup in that particular area. So healthcare delivery systems actually are maybe the package of the nurses, doctors, instruments, or their aim to give the health services at the lower end and the lower cost also. Healthcare services, like the multiple services returned to individuals, families, or communities by agents to health professionals for the purpose of promoting, maintaining, and monitoring of the restoring health. So we can say the healthcare services system describe all the services required to maintain the good health, and this include the preventive care and cure for the patients. So prevention and cure both are important, and both the systems has been provided also by these healthcare services systems. So it's not only about the diagnosis, how to prevent that, how after prevention no relapse should be there of any of the disease. Suppose cancer hai, your COVID-19 virus or any type of virus or any type of disease should not be relapse again after the medications. Okay. Healthcare delivery system is the aggregation of the institutions, organizations, or we can say the persons who enter the healthcare system, who has responsible that they include the promotions of those healthcare and preventions from illness, detection, and the treatment of diseases and the rehabilitations. Okay, these all about the healthcare services or healthcare delivery systems. Now in India, we have the healthcare delivery services. Like India is a unit of 28 states now and 7 union territories. So states are largely dependent in matter related to the delivery of the healthcare to the people. Each state has developed its own system of healthcare delivery independent of the central government, because every time the central government could not be involved for the small rural areas. So every state or every territory or every district should have taken the responsibilities for their healthcare delivery system. The responsibility consists of policy making, planning, guiding, assisting, evaluating, coordinating with the work of state health ministers. So which doctor need to be called or which doctor need not to be called, which doctor is free when the time of calling. So that all need to be taken care by these healthcare service delivery providers. And it is actually under the planning system. Guiding system, it need to assist to the local people. It need to be assist to the local rural area patients, and evaluate and coordinate the work of the state minister. The health system of the India has three main links. Basically, the union healthcare organizations have three organs, like Union Ministry of Health and Family Welfare, Director General, and the Central Council of Health. So actually, why we are discussing all these things, why we are going through the rural area, the center, rural area should be different from the district area, and the central area should be the distinct from the, because we just need to understand that the centralized, the things cannot be happened every time. So if we talking about the any type of health delivery system, that means it has been governed by centrally, but the centers could be the different district wise, the area wise, the local rural area wise. So here we have the ministry involvement, obviously involvement of the ministry, Directorate General, and the Central Council of the Health. Now, what would be the future of telemedicine or telehealth? So if we say that telemedicine or telehealth actually is it would be the safe and secure, sustainable care delivery models, And it would be the collaboration with some specialized society, the Indian society, the government societies, or the industries. It would be uh, by the private industries also, but in the collaboration with the government. Improve access to care and care conditions, encourage greater fidelity interagency alignment. So the future, in future, we can say the telehealth would be the future of the healthcare systems. It would be increase, or it would be increased day by day, or it would be helpful with, it would be helpful if every rural area have at least one uh, telemedicine or healthcare service package with their village or with their nearby village, so that the patients can be access to that particular healthcare services or telemedicine services. Uh, if we say so, if we can do that, then definitely India would be the better India in comparison of now. Encourage greater state actions, integrate with health information exchange, true integration into the mainstream healthcare. So these are the different applications actually for the telemedicines. So telemedicines is the one part, and to provide the telemedicines, we have the healthcare delivery systems. So telemedicines applications. So where we have different type of telemedicines applications like tele-monitored procedures like surgery, robotics, home care, disease management, disaster management, continuing medical education, disease surveillance, remote consultation and critical care monitoring, and second opinion and complex interpretations. So telemedicine's applications are more other than those also, because telemedicine actually has no boundaries. Telemedicine is everywhere. We, if the patient is not, if the any, if the person is not a patient, means if the person don't have any disease, but it would, it may be some hidden disease, or it may be some it may be some hidden disease which have not given the symptoms yet. So for that also, the telemedicine is useful. That means this disease surveillance or the surveillance of that particular patient. Suppose a BP is there, always a patient have high BP. So that could be a disease, or that could be a symptom of some severe disease, or sometimes chest pain is there. So chest pain may be from the gas, from the gastric patients, of the gastric patients, and chest pain may be because your heart is not pumping well. The chest pain may be recorded like through ECG, ECE, or ECG. We can record that particular chest pain if the any type of nerve has been blocked or not blocked, if the gastric pain is there. So that could be on the surveillance part, or that could be the monitoring part or the program tracking part. So if the patient always having these type of pain, chest pain, back pain, so that could be ECG can be done through the by the medical primary healthcare worker only in the villages. So that can be mapped, or that can be judged by the any type of consultant. Like disease management also there, telemedicine services are also there, second opinion is also there. Suppose some uh, some one doctor says like for example we can take the chest pain only. So some doctor says it's a gastric pain, so the patient can have the second opinion with some other specialized doctor, because now on the telephonically or now on the video conferencing we have so many specialized doctors. So patient can take the second opinion and complex interpretations and show the complex interpretations to the uh, complex or simple even interpretations to the another doctor. So the accessibility actually of the doctors are too many, and for the doctors, the accessibility of the patients, too many patients are there. So it's a, I mean, it's a A win-win situation for both, for the doctors and for the patients also. Current uses and applications of telemedicines, like decision-making apps, aids. Telemedicines have three main areas like decision-making aids, remote sensing, collaborative arrangements for real-time management patients on the distance level. So decision making obviously simple application hai, and its use of online computer database for clinical patients, and search engines like it can search by through the abstract or one liner code. We can search the patient's problem, and easy access of the detailed medical information of the patients. It can be used for the self-diagnosis also. It can be used by the healthcare diagnosis also, or it can be used for the specialized doctor diagnosis also. So what kind of actually the disease is, the diagnosis or the consultation done on the same basis. Like if the health worker map everything. If health worker map the all the parameters of the patient and health worker think it's serious, then only it can be considered for the specialized doctor. If health worker thinks through the parameters and health worker analyze, it's a simple case. So it can be mapped and it can be diagnosis through the mapping only. So remote sensing also involves the transmission of the patient informations. It includes the ECG and digital X-ray data. So are very important things. These are very important things when we say about the imaging system and when we talk about the ECG system. So based on those ECGs and X-rays, the doctors can diagnose those type of disease, or doctor can diagnose it very minutely. And remote sensing raises the issues of the patient record and the patient consent also. And next, finally, third area, we have the collaborative real-time patient management. It represents the most innovative category of the telemedicine and is the primary focus of the review. Real-time patient management means we can say the live monitoring, right? So if the patient having some severe disease, some serious disease, so live monitoring system is also there. So collaborative video management through video conferencing, it allows the remote practitioners to observe and discuss their symptoms with the patients. Two-way workstations are there, and always the doctors, always the patients can be sent their parameters, ECG parameters or digital X-rays, CTs or MRIs to the directly to the doctor. So this is the worldwide collaboration of telemedicine, like with Delhi, Mumbai, Hyderabad, Kolkata. These are the major stations, and here all these has been merged. All these has been merged here. Delhi to Chandigarh, Ludhiana, Jaipur, Indore, Bhopal, and this is the actually the networking system of the telemedicine. This is it's least telecommunication devices are there. See, we can have the super specialized hospital in Delhi and Kolkata, and some few areas, small rural areas, has been merged with those super specialized hospitals. So yes, now come to the benefits. So benefits are too many for health care services and health delivery services and telemedicines. So benefits obviously for the healthcare. First of all, it reduces the travel time. It reduces the travel time it reduces the travel time of both, like the patient's travel time also and the doctor's travel time also. Time saving for the patients and carer, faster access to care and access to better health care, improvement in the quality of the care, because when we have the time and when we have the specialized doctor, so we can only think over the diseases, we can only think over the diagnosis. So that can give the specialized advice when it's not available locally. So if we go to some hospital, only the few access of doctors we have. But when we go with this telemedicine services or e-medical medicine services, then we have the access of worldwide doctors. So we can engage or we can have the any of the doctors which can be merged or which can be engaged through that particular healthcare service or telemedicine services that can be access to for any of the patients. Improve communication. Yes, it always improve the communication with the results of tests and images are readily transmitted. It's easier and better way for the education, better access of information, better resource utilization, and obviously it's always better for the costing. So we if we want to actually to conclude that whole of the presentation, so we can say like the telemedicine, one small step for IT, again leap for healthcare. So if we want to give a brief regarding the telemedicine and healthcare services or healthcare delivery system, so we can say that telemedicine actually or proven could be a powerful tool when reductions or when the availability of the few doctors, few physicians in the small area. Because every time the specialized doctor or very big doctors are not available for the rural areas, because in the cities or in the metro cities they can earn a lot or they have so many patients, so why they need to look to the rural areas, right? But through the medical services or through the medical telemedicines or through the healthcare delivery systems, that can happen. The specialized doctor can move to the rural area through the communication channel, through the communication satellite channels, through the telemedicines, right? So telemedicines actually gives the boom or the specialization to the small patients and the patients which cannot afford or the patient which cannot go to the specialized doctor, and that can help to clearly diagnosis or determine treatment tactics. So it's extremely necessary to reach the technology into the rural areas where access of the quality health worker is limited. Telemedicine programs actually have a great potential to completely change the way to healthcare services where the access is not there. Some time of benefits have been provided on the quite distinct distance level. So the distance is too large, but the medical facilities can be provided in the large distance through the telecommunication device. It helps to solve the transportation limitations also, because no going and coming factor is there. Help in building up the economy also, and strengthens the doctor patient engagement and improve the frequency of the consultation due to the reduced waiting time. A patient small parameters can be judged or can be analyzed through the doctors, through the live facilities, through the conferencing facilities. So we can say the vital parameters or small parameters can be judged by the specialized doctors also because of these facilities. Now, access to the healthcare experts across the global, it has been increased, and chances of getting a second opinion has been improved through these services. So once these type of populations or rural populations adopt the technology, it results in better patients outcome in the terms of treatment and the healthcare accessibilities. it always gives, or the collaboration. This telemedicine actually is the collaboration of medical and IT backgrounds. So because medical facilities can be provided, these type of medical facilities can be provided through the electronic and telecommunication technologies. So healthcare delivery system with with the telemedicines always have some organizations that can provide the medical professionals like doctors, nurses, patients, staff, machines, telecommunication devices, conferencing system. So when we have all these things, it makes the healthcare service provider and the telemedicine. And healthcare delivery system describe all the services required to maintain the good health. This include the preventive care and the intense care for the patients, for the serious patients. So at the end, we can say the telemedicine and the delivery system, the